Hello, my name is Christiana Apaxu, and we will be discussing a practice approach to hypertension prevention and management. We nurses witness how disease affects patients day in and day out, and due to this, we can become immune and our feelings can get tucked into a nice little box in the back of our minds. This is not due to the disregard for people we have the opportunity to care for, but rather as a means of survival. Every now and then, we have patients that bring those emotions out, but that can be few and far between. These emotions come out in full force and make us truly face the gravity of certain disease processes when it affects one of our own. Last Christmas, my father flew in from Virginia to spend the week with my family. He unfortunately developed a cold while spending the first few days at my sister's house. My father decided to do what he could to self-treat his symptoms. He took 3 times the recommended amount of Emergency, as well as including your typical over-the-counter Dayquil and NyQuil. What he did not consider was that these medications might negatively interfere with his anti-hypertensive medications. This medication cocktail resulted in stroke-like symptoms that turned into Christmas evening in the ER. This was a very scary event for me, and looking back, it made me truly understand what it is to be on the patient's side of things. My father is an educated man and does well for himself as a practicing lawyer, yet he very easily fell prey to polypharmacy. This personal life event is my inspiration for proposing this practice approach focused on the disease process of hypertension. We'll be looking at navigating hypertension through a holistic approach. So, my father is not the first person or only person to be affected by hypertension. According to the CDC, nearly half of adults in the United States of America have hypertension. About 1 in 4 of these adults with hypertension have it under control. That's 1 in 4. All adults with hypertension are recommended by their clinician to undergo lifestyle modifications, but unfortunately, this is the only a treatment recommendation for 1 in 5 of these United States American adults with hypertension. Most adults with hypertension, 4 out of 5, are recommended by their clinicians to take prescription medications to control their hypertension. This practice approach that I am proposing is aimed toward decreasing that specific number right there, that 4 in 5 adults who are on prescription medications for hypertension. This program, this practice approach that I'm proposing, will be specifically implemented in Escambia County, where I reside. The current population for 2025 Escambia County is 334,516 people. For the population in 2019, that population was 326,928 people. Since 2019 to this point on, the population has increased by 0.7% each year. So these statistics that I'm about to go over, they're from 2019, but they are still relevant today. So concerning the population here in Escambia County with hypertension, 36.2% of those adults have been told by their care providers that they have hypertension. Of that 36.2%, 78.8% are on blood pressure medications. So of the percentage that does have hypertension, more than half are unfortunately on blood pressure medications. So the practice approach I'm proposing would be to implement a telehealth hypertension prevention and dietary management program that is aimed towards reaching clients below the income poverty level. The goal is to reduce the need for antihypertensive medications through dietary education, as well as self-monitoring and reporting. The framework that will be utilized will be the Check, Change, Control framework. It was proposed or created by the American Heart Association in 2022. We'll get into some of the details, but some of the things I propose within this framework will be virtual classes that will be the option of it being via a live in-person virtual class, and we will also have our self-paced modules as well. We'll also be implementing virtual check-ins with the public health nurse via virtual communications. And then we will also have annual check-ins that we will ensure that our participants in this program are following up with after the program has finished and concluded. And the other thing that we will have as part of this program, which I will get into a little bit more specifics, will be farmers market vouchers. This is going to be an important part of this program. So to get into a few more details, with these annual check-ins, the people that we are going to specifically be looking at, again, are going to be our underserved, low-income population. The clinics that we will be partnering with will be in this area, the Health and Hope Clinic, the Community Northwest Florida Clinic, and the Escambia County Health Department. And within that health department, we have our SNAP and WIC participants that would qualify as our low-income population. So those are the people that we will be coming alongside in order to actually find participants to be a part of this program. So in more details about Check, Change, and Control, this is again created by the American Heart Association based off of evidence-based practice. It is a 4-month program with each month focused on patient-centered, team-based blood pressure management curriculum. The American Heart Association provides a manual that has excellent resources that can be provided to the patient, as well as resources that can be used by the healthcare team to better structure patient meetings, team meetings, education modules, as well as a pre-intervention and post-intervention survey. Using these resources provided, we can implement 3 phases for a successful implementation of this practice approach. The 3 phases are activation, promotion, and implementation. The first phase is going to be activation. During this phase, the team will be formed and trained by a DNP educated nurse who has reviewed the evidence-based practices and tailored it specifically for the community that it will be implemented in. The DNP RN will also educate the team on the desired outcomes and train the team to execute the plan tailored again to the Escambia County community. After the activation phase is completed, we will then move into the promotion phase. During this phase the recruitment of the participants will take place. Materials will be provided to the Health and Hope Community Clinic, Community Northwest Florida, as well as the Escambia County Health Department to ensure that the underserved, underprivileged communities are reached. The targeted audience will be provided with a projected kickoff date of the program so they know when it will be started. Once that phase promotion is completed, we then move into implementation, which is where we will find the meat of the program. So during this phase, this is where we will actually start the blood pressure monitoring and all of the other interventions discussed previously. So we will have those virtual classes that will be meeting monthly. The patient during this time will be educated on how to self-monitor, how to accurately self-monitor, I should say, how to properly record their recordings. There will also be virtual check-ins one-on-one with the public health nurse via virtual meetings to make this easier and accessible for those who are unable due to time constraints to come in to an office to actually have a meeting with someone in person. So we'll also have those virtual meetings so that we can check in on the patient, ensure that the education that they are consuming is actually sticking and getting deeply rooted, so they have a greater understanding of why we need to truly manage this disease process. And then we will also have the annual healthcare provider check-ins as well. Amongst all of these check-ins with people who are part of the program, the American Heart Association also offers self-paced learning modules. I was actually looking through a few of them, and they're very interactive and very educational and fun to watch. So the patient will also have access to those as well. At the end of the 4-month implementation phase, a final follow-up will be completed, and the participant will then be discharged from the program with the resources to continue in successful blood pressure management. Now, I said we would get to this just so it ties in here. We also have those farmer market vouchers. So the evidence-based practice behind these vouchers is based on decreasing the cost of unprocessed organic produce to our current population, our below the income poverty line level, underserved, underprivileged community. So the authors of the Dietary Impact of Produce Prescriptions for Patients with Hypertension, it reiterates that underserved, underprivileged communities do not have financial access to fresh produce due to cost. This leads to these communities purchasing cheaper, processed alternatives with little to no nutritional value. As we know, as we found through science, if patients are consuming McDonald's every single day, we have those greasy, fatty, high salt foods, that's going to greatly contribute to increased rates of hypertension. So our alternative to that is to provide these farmers market vouchers in hopes that since it is available now to this population, that they will actually implement it into their diet and start to consume it. And we might not be able to see short-term results due to it, but we can see long-term results in the years to come. In the article, Managing Blood Pressure with a Heart-Healthy Diet, this is an American Heart Association article based off of their guidelines for a heart-healthy diet. It is well known that the heart-healthy diet helps to decrease the risk of cardiovascular disease, and hypertension is one of those leading contributors to cardiovascular disease. So a farmer's market voucher to give to the participants in this practice approach would go a long way to help reducing cardiovascular disease. I just wanted to throw this out there as well. It's not related to hypertension, but this initiative has also been used for other disease processes, specifically diabetes mellitus. So in the articles, Farmers Market Vouchers, Initiative to Improve Diabetes Control in Older Adults, they did not have any significant statistical findings, but we do know, just based off of what we know about nutrition and the importance of good nutrition in the diet, that it will have long-term positive effects on hypertension and cardiovascular disease, and in this case, diabetes mellitus. To further prove the need for this practice approach, the Healthy People 2023 Collective recommends the utilization of a Community Preventative Services Task Force. So that is a long phrase right there, but that is simply going to further back up this check, change, control framework that we will be implementing or proposing to implement here in the Escambia County. So this task force will be used to carry out the following recommendations to prevent cardiovascular disease. So these interventions are screening and health education, outreach, enrollment and information, a team-based care approach, patient navigation, and community organizers. So based off of the check, change, control framework and what I have already described previously, I do believe that this practice approach is truly based in evidence-based practice, and the Healthy People 2023 collective information here backs that up greatly. According to this collective, these recommendations listed here, they improve blood pressure and cholesterol when used in a team-based care model. And there is even evidence to show that these type of implementations reduce morbidity and mortality related to cardiovascular disease. They can also help improve health and reduce health disparities in minority or underserved communities. And it has also been found that these recommendations, when implemented, are also cost effective. So this would definitely help to keep it in a primary prevention, maybe even a secondary intervention program, just making sure that we are preventing the disease process, but also in a sense screening for it as well. But trying to avoid going into our tertiary care where the patient has the disease and we are just trying to manage it long term. The theory of the whole person was utilized in structuring this current practice approach. It is a grand theory and it addresses the four major concepts of the nursing meta paradigm within the context of biblical definitions. Even though this practice approach is focusing in on one disease process, the end goal is to meet the patient where they are and have a targeted conversation to determine the root cause, whether it be intrinsic or external. The public telehealth nurse that we will be utilizing will not be able to solve the client's problems, but hopefully the client will be able to come to some sense of realization about their current health status and the changes that they need to change in order to change their health trajectory. This theory provides an understanding of how the whole person is impacted by extrinsic factors such as family and community as well. I appreciate this part of the theory because we humans are not islands and we do much better together than when we are alone. And that further reiterates that need for a team-based approach. When these factors are taken into consideration concerning health, an improved picture of the client is provided, and we as a team, the providers and the client, can create a health plan tailored to their specific needs. In this case, hypertension management. This theoretical framework greatly emulates the Ignatian principle curis personalis. According to the Jesuits, curis personalis is defined as caring for the whole person. When a nurse encounters a patient, they need to assess the internal factors such as their emotional and spiritual state and their intelligence. The nurse also must consider those external factors as well that may fall under family beliefs, cultural differences, and religion. Now, we don't quite use that term in the healthcare setting. What we would call curis personalis in the healthcare setting would be patient-centered care. That is very similar. This can be summarized, patient-centered care can be summarized as integrating the preferences, values, and beliefs of the person into the process of the decision-making, producing a treatment plan that is both appropriate and meaningful for the patient. Patient-centered care also supports the role of patients making informed and active choices rather than remaining a passive recipient of the care. Curis personalis, or patient-centered care, is very important to this practice approach because yes, we will be providing these resources for the patient, and yes, we will be doing a lot for them to come alongside them, but it's going to take them to fully implement it on their own to help better and improve their health care. So it is a team-based approach. We need to meet the patient where they're at, get a better understanding of who they are individually in order so that this program can actually be beneficial for every individual participant. So how does the DNP RN fit into this practice approach? Well, as we know, the DNP is not a research degree, but rather a degree that utilizes research with the goal of implementing it directly into field practice. This is important because as a DNP prepared nurse, we can analyze the research already completed and tailor it to our needs in our individual work areas. This is important because research is typically conducted in a controlled environment, whereas evidence-based practice is implemented here in the real world. So, to meet the goals of disease prevention and health promotion, the DNP requires greater autonomy and continuous interprofessional collaboration, which we will see as we implement the check, change, control framework for this practice approach. The current state of acute healthcare treatment emphasizes the treating of the disease process rather than looking at the patient's entire life. I do believe that this is a necessary role and that a DNP-trained RN can complement this with working with the other end of the spectrum, preventing disease before it happens. And utilizing the nursing process, because this is something that no matter what level we are at as nurses, we will always be using this. We start off with our assessment. The DNP RN assesses that the underserved, underprivileged patient population is less likely to seek out healthcare independently until it is a last resort, and this contributes to a lot of tertiary healthcare problems. The diagnosis this DNP student is making is that there is restricted access to nurses that are academically prepared to provide care via the nursing process. We can use nurses to reach to those who typically would not come into healthcare. We can, because of the technological advancements that we have nowadays, we can reach them. We don't have to go directly to them, but we can just have a simple phone call. We can have a virtual meeting with them to meet them where they're at, to decrease that restricted access. As far as planning, we will implement the prevalence of nurses in the community setting, and with this practice approach, we will be carrying that out virtually. As far as implementing, we will be using that check, change, control protocol from the American Heart Association, and the goal of that will be to bridge the healthcare access gap. In evaluating, we'll be looking at where the patient started off in their blood pressure journey and making sure that we are improving the outcomes in the patient population concerning their blood pressure. So that is how we will utilize the nursing process in this practice approach. The DNP essentials that I felt were most applicable to this practice approach were DNP Essential 6, interprofessional collaboration for improving patient and population health. Through this practice approach, these practice guidelines will be implemented, led by the DNP RN. It will be also a team-based collaboration with other care providers, the patient, as well as their primary care provider. The DNP will ensure that clear communication is in place between all with the goal of improving patient and population health. The other essential I do believe is applicable to this practice approach is Essential 7, clinical prevention and population health for improving the nation's health. The check, change, control framework is based on primary and I would also say some secondary interventions or care, as it is both working to prevent and educate the population on prevention of the disease, but it can also help to screen and catch elevated blood pressure readings early on and guide the participant through the next steps, whether this be establishing care with a healthcare provider or so on. So these are the DNP essentials that I truly believe are applicable to this practice approach. By the grace of God, I live in an area that has 3 excellent hospitals within 10 minutes of my house. And because of that, my dad received excellent care. But there are those who are not so blessed and are left to manage their health on their own with minimal contact with healthcare providers. My father thankfully made a 100% recovery and traveled safely back home. And I am so grateful to God for this, but not everyone can say the same. We live in a society that claims to be the most advanced as we have ever been in the field of science. Yet despite these improvements, we have failed at our healthcare basics. If we fail at primary prevention, then our secondary and tertiary preventions or interventions are like placing a Band-Aid on top of the hemorrhaging wound and hoping for the best. Joyce Travelby, a nurse theorist, said, "A nurse does not only seek to alleviate physical pain or render physical care, she or he ministers to the whole person." In conclusion, as we finish out here, I just truly believe that taking the check, change, control guidelines and implementing this into this practice approach would greatly benefit the Escambia County area as a whole, and hopefully in the years to come, it could even do much better for the entire nation. Thank you.